Well, as the U.S. continues to battle COVID-19, healthcare workers say they are overwhelmed with fatigue and fear. A survey conducted by National Nurses United reveals roughly 31% of hospital nurses say that they have seen an increase in workplace violence that is up from 22% in March. This increase in violence comes as COVID-19 patients fill up nearly 11% of hospital beds and over a quarter of intensive care units across the country. So for more on this, we want to bring in urgent care nurse practitioner Justin Gill. Thank you, Justin, so much for joining us. So a hospital in Missouri has started to issue panic buttons to nurses and hospital staff due to an increase in assaults. I'm kind of curious about what you have noticed in terms of, violence, and it doesn't need to be physical violence, but even sort of aggressive language towards healthcare workers in your area. Often nurses are really the ones doing the lion's share of interacting with patients, and patients are desperate and they're scared, and, you guys are kind of like the first line of defense.
Yeah, thank you, Anne-Marie, and thank you, Vlad, for both having me here this morning. I would have to say that, our nursing workforce is our foundation of our healthcare system. Violence against nurses, violence against healthcare workers, assault against healthcare workers was an issue even before COVID-19. But I think that COVID-19's really exacerbated some of the issues when it comes to acknowledging that your healthcare provider is there to help you, not hurt you. COVID-19, I think, has distorted some of the perceptions of what our healthcare system is able to do for you and what we are there for. We are not there to promote an ideology or a political philosophy. We are not there to, push any specific harm on your healthcare. We're there to help you. And I think that perception helps fuel some anger and some mistrust amongst some people that may come in. And I'll tell you, nurses are exhausted. Frontline workers like myself as a healthcare provider, we're exhausted. We are seeing 100%, 125% of our usual volumes for the summer. And we are afraid of the volume increase over this coming cold and flu season. We're being asked to do as much as we can with limited resources. We are asked to provide high-level quality of care with staffing levels that may not be adequate. So, there's a lot of different challenges here that I think, we have to be careful because we don't want to deter people from entering the nursing profession or entering any healthcare field because it's an honorable profession. But we need to make sure that we're protecting our nurses, protecting our frontline workers, acknowledging the fact that they're working in unprecedented times. And I think that if we do that, we can not only get out of this situation that we're in now, but help prevent certain situations and pandemics in the future.
Justin, let me ask you about schools. As you know, they're opening up across the country, and school nurses are also facing burnout amid the pandemic. Parents picking their kids, their sick kids up. They're likely to bring them to urgent care facilities like yours. Let's talk about pediatric cases in your area. What's that like?
Yeah, just like all numbers of cases, we're seeing them go up in nearly, every population and every group. With children illnesses, when kids go back to school, when kids go back to daycares, in an urgent care clinic, we'll commonly see people come in with things like RSV, flu, regular cold viruses, just because of the nature of kids coming together. In addition to that, we're seeing COVID start to spread. The difficult thing about COVID-19 is that it's very hard to distinguish between the symptoms of COVID-19 and that of other respiratory viruses. Most children do have very mild symptoms with COVID-19, but the problem is that they can be contagious and spread it to their loved ones at home. So when we look at, schools, school nurses are going to actually be part of the solution here. And I think that they've also been a neglected area of our healthcare workforce for a long time, well before COVID. And now they're being asked to help manage some of these programs in schools. I think it's very easy for people to just say testing needs to happen in schools by the school nurses. But is there the staff? Is there the appropriate resources to actually be able to support something like that? we are seeing a large number of pediatric upper respiratory infection symptom cases in our urgent care clinics. Many of those patients are waiting in those clinics on average 1 to 2 hours, and that's pretty standard across the country. I think at this time, we have to make sure that we are testing students, we're doing that contact tracing, and supporting school nurses the best way that we can so that they can effectively do their job and prevent outbreaks.
So there's a new study from the drug company Merck, and it claims that its experimental oral COVID-19 antiviral drug is likely to be effective against COVID, including, the variants that we know about, like the Delta variant. So I figure that this is probably a good option for at least certain people. Who would likely be a good candidate for this type of medication?
Yeah, this is exciting news. I think anytime we have any outcome, news that comes out that shows positive outcomes for treating COVID-19, I would say that, this is something that we could use in the general population because it's a pill. It's a medication that's taken orally. And based off of the small trials that Merck had done, it had shown improvement in viral load. People had tested negative in the group that had taken the pill versus the group that did not. Sooner than the other group, and it treats COVID-19 infection. The difference between this and some of the other options that we have available right now, monoclonal antibodies are also a great option for people right now who test positive for COVID-19 and are high risk because it reduces your chance of hospitalization or death. The thing with that is it's given via IV, meaning it has to be given in a supervised healthcare setting. Same thing with remdesivir, which is given in more severe cases in the hospital through an IV or a hospitalization. So this is a game changer, I would say, if it does end up getting approved and show clinical benefit in the phase 3 trials, which hopefully should be done sometime in November. And it'll give us another tool to be able to effectively fight this virus. But again, this is not going to end anytime soon if we don't get a handle on vaccinations, if we don't get trust in what our scientific institutions are doing when they approve these medications, because there's other pills that people are taking right now that aren't really effective against COVID-19, things like ivermectin, hydroxychloroquine, things that are not proven to work based off of our evidence-based institutions. So if this does come out, we also need to make sure everybody has access to it, everybody is able to understand what it does, and healthcare providers are empowered to be able to help people and educate them.
Justin, the CDC is urging pregnant people to get vaccinated. The agency says cases of COVID-19 in pregnant people have a higher risk of admission into intensive care and a 70% increased risk of death. Help us understand why this may be likely during a person's pregnancy.
Excellent question. And this is something that's on the minds of a lot of pregnant people, both I know, as well as the pregnant people that I see in my urgent care clinic. Pregnancy is a time period in your healthcare where, you're dealing with a lot of potential negative situations, right? Just assuming some level of risk in many different scenarios. With COVID-19, we do know that there is a significant risk of harm to the fetus as well as the mother. If you're not treating the mother and you're not making sure that the mother is well, you can't be able to effectively take care of the baby or the fetus. So, with this, I would say, this is something that we've told pregnant women is that while it wasn't a part of the initial clinical trials, we have much more data now to be able to support the recommendation to get vaccinated. Anytime you make a recommendation, you're weighing risks and benefits, right? In this case, the benefits of getting the COVID-19 vaccine in the pregnant population far outweigh the risks that come with potentially contracting COVID-19. And I've heard from some pregnant women that they'll say, well, I stay home, I won't get, COVID-19. And you can try your best many times, but this is a highly contagious virus, meaning that if you go to the grocery store or you go to any public location or you have other people in your household that do that, there will be that risk that's there. With this, we just have to make sure we're doing a really good job in educating people that this is a standard recommendation coming from our evidence-based institutions that are saying you should get vaccinated. It'll protect you and it'll protect your baby.
All right, Justin
And you
Gill.
know, Vlad and
Sorry,
Justin,
go ahead.
it's not just that. Oh, well, you just said it in the tail end there, Justin. It'll protect your baby, because we now know that these protective antibodies that, you know, women get after they are vaccinated are then passed on to their child. So it's a twofer. It's worth it. It's worth it to get vaccinated.
It really is. Justin Gill, my friend, thank you very much. Appreciate it.
Thank you.